So in general, neuropathy is a very common condition. They affect up to 1% of the general population, and they increase with age. And they are very frequently also complex conditions in which diagnosis and management are frequently referred to specialized clinicians. For this reason, there is often, especially in rural areas, underserved areas, a high rate of misdiagnosis and delay. And this is a current issue in our everyday clinical practice as peripheral nerve disease specialists. At the same time, of course, the AI, we all know that have undergone a tremendous change. They're increasingly available, increasingly powerful, increasingly able to show clinical reasoning in their responses. So the aim of our study was to assess the efficacy of these tools to help clinicians, specialized and non-specialized in peripheral neuropathies, in evaluating real-life cases. In order to do so, what we did was we collected 100 clinical cases from real-life tertiary care hospitals, and we constructed text-based clinical summaries in a standardized fashion. And for each case, we prompted into Chat-GPT first. We used a specialized prompting techniques, which is called the zero-shot chain of thought, which is known to increase the reasoning abilities of Chat-GPT. And we recorded the output of GPT as leading diagnosis, differential diagnosis, and possible confirmatory test for management of the neuropathy. At the same time, we enrolled a panel of 36 neurologists from 10 different countries who reviewed the same clinical cases and could provide comparable outputs. This was designed, and they can also review the GPT output after giving their first diagnostic, for example, intention, and then they could review their diagnosis based on their revision of the diagnostic output of ChatGPT. Well, what we found, which was very interesting. So first, ChatGPT is less powerful, both in terms of diagnostic capabilities and management capabilities, compared to specialists. So specialists still hold the best performance metrics. What we observed, which is very interesting, is that non-specialized clinicians actually have a performance in terms of differential diagnosis accuracy and confirmatory test accuracy which is lower than ChatGPT. And also they reviewed their diagnosis in 21% of the cases after evaluating GPT output, and increased their performance with the GPT help. We also performed an error analysis. We saw that the main mistakes of GPT are due to flow deduction and some hallucination also. And so our general conclusion is that this tool may actually already be efficient in helping us to bridge the gap in knowledge between non-specialized doctors and specialized doctors in order to hopefully streamline the diagnostic process. So a non-specialized clinician faced with a complex case of a neuropathy may seek the help of a large language model and ChatGPT in order to be provided with differentials, with possible management possibilities to increase its performance and hopefully get to the diagnosis faster with the help of the specialist, of course, and in this way improve patient outcomes. We think it's a very interesting study. It's the first time this has been recorded in this kind of diseases, and maybe also a model for other more complex diseases from other fields, we think.